Okay, y'all, so I am studying, so I figured I'd bring y'all with me or have y'all study with me. So basically, when I think of diseases and systems of the body, I try to break it down. So right now, I'm studying bacterial and infective endocarditis. So when I think of it in a whole, I think of it as, say this patient came in the emergency room and we already know what they have. I'm going to break it down into what is this actual disease, the patho of it, how do people get it. Then I'm going to break it down into the signs and symptoms, because this is pretty much how, well, it will go in order from the patient will come in and present with these type of things. But for the sake of just having order, I'm going to go into, this is what it is. This is what the patient will present with. This is how we find out what it is. This is how, how we diagnose it. This is how we treat it, and then patient education. So bacteria in infective endocarditis. So basically what that is inflammation and infection of the endocardial layer of the heart. So when the patient comes in, or let's start over. So when the patient usually gets this by staph infections or strep infections. So if you have a strep throat and you don't go get it fixed, you don't go get the antibiotics to get rid of it, it will turn into BIE. Also, people can get it from MRSA as well. So when a patient comes in, the way I like to think of the signs and symptoms is, what is the issue and what comes with that issue. So when you have infection, usually fever will come with that, and if you have fever, you will have chills. A lot of complications with the heart is chest pain, so that's also another sign and symptom. Angina, murmurs is also a big thing with this. Headaches. What else? There are 3 cardinal signs associated with this. So patients will come in with what they call hemorrhagic splinters, I believe. So it just looks like you have splinters under your nail. They will also come in with what they call James-Way nodules. So they're just like spots on the hands. And then they also have ulcer nodes, which are also lesions on the hand, but they're like a purplish color and are actually tender. So those are the 3 cardinal signs of bacterial infective endocarditis. So another sign and symptom, and this is once you get into the heart and you look around. So when the body is presented with infection, it reacts basically. So it sends white blood cells, fibrin, all those things that help fight off the infection. So those things go to the infection. However, if it's on a valve, the valve is just usually like a leaf. It looks like a leaf, but they call it vegetative lesions, because once the bacteria is on the valve and then all of the body's defense mechanisms go and attack the bacteria, it looks like a romaine lettuce instead. And so that's why they call it vegetative lesions. So now let's get into diagnosis. How would you diagnose this? You would do a physical assessment. Obviously, you always want to touch your patient. Don't be afraid to touch your patient. You will also do a cardiac cath. And basically, a cardiac cath is when you go through the femoral or brachial artery and you start to look around. You look at the vena cava, you look at the arteries, you look at the veins, you look and see what's going on, what doesn't look right. You will also do blood cultures. Remember, this is a bacteria. So in order to fight the bacteria correctly, you want to know what kind it is so that you can use the correct antibiotic. So you will go in and do a blood culture, and it needs to be in separate arms, one on your left, one on your right, obviously, 30 minutes apart. And then that will tell you what type of antibiotics you would need. You will also look at labs. When you have infections, you're going to have increased blood cells, platelets. You're going to have ESR you need to look at, and your CRP, C-reactive protein. And ESR and C-reactive protein both will tell you about inflammation. Inflammation. And so the ESR is non-specific. It will increase no matter where infection is in your body. What else do you want to do? So once you go in and you look around and you diagnose, okay, this is what this person has, you also can ask, going back to the signs and symptoms or doing your physical assessment, have you had a sore throat? And if they did, usually when people don't treat it, that's when they get BIE. Also, IV drug users are at a greater risk for getting this as well. So once you have it, cardiac cath. When you do a cardiac cath, it is very important that because you're making an incision and you're going into the vein. When you go into the vein, that's very serious. So you have to apply pressure for up to 8 hours. The person is on strict bed rest. They cannot fold their leg. Their leg has to be straight, and they have to be in a semi-Fowler position. If this patient bleeds at all, you need to call a code because they can bleed out. Let me see what else. So treatment. The patient is going to be discharged on antibiotics and anti-inflammatory, which we know are steroids. The antibiotics will be given through a PICC line, and they have to adhere. So this is part of patient education. They have to adhere to their medication regimen. A lot of people, once they start to feel good, they stop taking the antibiotics, which then makes the bacteria resistant. So make sure you tell the patient to adhere to your medication regimen, because this is going to be 2 to 6 weeks. That's a pretty long time to be on antibiotics. You also want to make sure that, because their immune system is going to be weakened, because we know the antibiotics, they kill the good and the bad bacteria. You want to make sure that they stay away from large crowds and stay away from kids. We don't need anything, them coming into anything in contact that can weaken their immune system even more. I'm trying to think, did I forget anything? I think we good. So that's bacteria, infective, endocarditis. All right, so our next one is pericarditis. So your patient comes in and they say, I got pericarditis. I don't know if that ever happens. That rarely happens. But we having a good day. Patient comes in, says, I have pericarditis. I have shortness to breath. I have a fever. I have a sharp stabbing pain when I inhale. When I auscultate, I will hear the pericardial friction rub. I know the pericarditis is caused because basically what that is the inflammation. So the pericardial sac is what protects the heart. Between that sac is also fluid. So pericarditis is the inflammation and infection of that sac. So it can be bacterial, it can be viral. What's the other one? Bacterial, viral, fungal. It can be all three of those things. So how do we figure out what kind it is? So instead of taking a blood culture, what you would do is Pericardiocentesis. So basically they would go in with a needle to the heart, pull that fluid out, and they would test it to see what type of infection it is. You can also do a pericardial window. So they'll go in and take a biopsy of that pericardial sac. You can also, you always want to do an EKG. Like anytime somebody comes in complaining of chest problems, you always do an EKG, and then you can also do an echogram. How are we going to treat that? Or when we do our labs, what are we looking for? We want to do a complete CBC. You're going to see the same thing as you've seen in BIE. You're going to see increased ESR and increased I don't know why I can never remember this, C-reactive protein, CPR. What else? So treating these patients, you treat them pretty much the same as you treat BIE. Antibiotics, anti-inflammatory. You also could do antipyretics because this patient is going to have a mid-grade fever, so 101 or 102. So you can also treat them with that. They will also be discharged with antibiotics through a PICC line. You want to keep them on strict bed rest. Remember, they're having heart issues, so you don't want to overwork their heart. Make sure they adhere to their medication, finish it out completely, semi-Fowler position. So you guys, today was the best day ever. I'm in clinical now. We're on break, our lunch break. So I got to see a vaginal birth. Like, God was looking out. Like, God really came through in the clutch today. Chilling, like, where were the desks? Y'all know where the nurses sit at. And all of a sudden, we hear this loud scream. And everybody, like, stopped and got up, ran to her room. When we got there, she was standing up, and her water had broke. It was just like a gush of fluid. It was just like clear fluid on the floor. And then everything just like, it's like everything that I would dream of when it comes to labor and delivery. Like, perfect patient, perfect situation. And she actually wanted to have a vaginal birth this time. It wasn't chaos. It was chaotic in the sense of, like, we went from sitting down chilling to, okay, now we about to deliver a baby. So they check her, you see the baby head. So it's 3 of us in there. I'm already gowned up, whatever. So they lay her down. The doctor come rushing in. He look at her. We see the baby head, and the dad is on the other side. She's screaming. We got a few nurses in there, but everybody, all nurses, they got their own job. Everybody know what they doing. So she was like, somebody come hold her leg, and I just happened to be right there. So y'all, I literally not only got to see the birth, like, I actually even got to help her. And in that moment, I was crying too, y'all. I'm such a sap. Like, I wasn't like bawling crying, but it was just like emotional. Like, it was just very intimate and just like, oh my God, like, life is coming into this world. Like, it was just very amazing. Like, I couldn't even describe it. Like, so we just talking to her and keeping her calm. Like, I 100% can see myself doing this, just like telling her, you got this, you good, like, you gonna make it. Because mind you, she never experienced this before. No, she had no epidural, no type of pain medications whatsoever. So I'm holding her leg, hoping her push. Girl, listen, y'all. Now, this part, it didn't trip me out, but y'all know that people tear down there. So the doctor, he gave her some lidocaine as she was pushing. Like, no, right before she was pushing. I don't know if because he just knew she was going to tear or whatever. But he gave her the lidocaine. And then he whipped them damn scissors out and began cutting because the baby head was right there. I honestly think if he didn't cut, she would have been fine. Like, she would have tore a little bit. But it was like a 3rd degree, I don't want to call it a laceration, but they like number the tears, and the highest is a 4th, I want to say, and hers was like a 3rd. Y'all, he whipped them scissors out and was literally cutting it, and I was just like, I looked, but then I was just like, I'm straight. It only took her, like, by the time her water broke and we laid her down and she began to push, it happened on all of maybe like 15 minutes. I want to say she pushed like 3 good times. The first time she pushed, it wasn't like controlled. It wasn't like we was coaching her. It was like we was trying to prep her and get her ready or whatever, and she just had to push. And the second time, the doctor was there and the nurses were there, and we was like, on this one, just push. And that's when the head came like all the way there. And then the 3rd push, that's when the head like literally came out. The baby head popped out his little and then he just pulled the baby right on out. It was so beautiful. I was just like, this is what I want to do. I really want to do mental health too. I don't know how God will incorporate that in my life and how he will get me to be in that field, because I am passionate about mental health as well. But labor and delivery, y'all, when I tell y'all, today made my day, because y'all know I'm stressed out. I got a test tomorrow. All I've been doing is going and coming. If it ain't school, it's work or clinical. So today made getting up at 6. What time I get up this morning? 6. Made me getting up at 6 o'clock like well worth it. So I just wanted to share that experience with y'all, because labor delivery, depending on what facility you work in, it really can be a hit or miss. I mean, like I said, this morning when we came in, I honestly was sitting there thinking, like, we're not about to do nothing all day today. I thought it was just going to be a quiet day. It was just amazing. Like, it was everything. Like, I definitely want to go into labor and delivery. Like, definitely. So, I'm about to chill on my break. I might try to study, but I've been studying there. I need to give my mind a rest and try to, like, let the stuff soak in. And I will talk to you guys later. Y'all, we in here doing some last minute studying in the car. This is how we get down. 5 people, 1 car. I'm in the middle. We gotta get in how we fit in, because y'all know we need to pass this class. We ain't got time to be failing. We trying to graduate on time. And ain't nobody got no more money to be paying for no extra classes. So we doing this last minute study. Y'all say y'all prayers up for us, because we all need to pass. We all got this like black girl magic, and then we got the Cuban magic in here. We love our Betty. So pray for us, y'all. I'll let y'all know how we do. Good morning, you guys. I figured I'd come and close out the vlog. It's only Wednesday, but that's what type of week I'm having. It's Wednesday, and as you can see, I am not at work. I really had to just take a mental day off. A lot of times when you just running, as I told you, I worked every single day last week. I had 2 clinicals. I've been working every single day, either in school or clinical or at work for like the last 2 weeks. I haven't had a day off. And sometimes when you just going, in the midst of it, you don't realize that you need to recharge. And like earlier this week, Monday, I kind of had like a mental breakdown because I didn't realize that I was just going. I didn't realize that, Shannon, you need to recharge. And so I had every intention on going to work today, but I was just like, don't. Take some time to spend with God, get back on a solid foundation, and regroup so that you can continue on. Rest and relaxation is just very important and essential to just even being able to go on, because you can't run on E. You just can't. So today is not even, I guess it is a me day. I mean, I'm not doing anything special other than just getting back grounded. Cause it was tough. It is tough going to school and working full time, and I'm blessed and grateful that I can do it. Don't get me wrong, but I also understand that I'm not superwoman. I understand that I need to fuel myself to continue to go on. So that's what today is. I don't anticipate vlogging no more for the rest of the week. I got an 82 on my test. Usually I'm not the type of person to be bummed about an 82, but I am. I wanted to do better. 82 was not bad by any means, but I just wanted to do better. I got an 82 on the last test too, so that's 2 82s, which is not bad. It's not bad. Let me make that disclaimer, but I don't know, I wanted to get in a 90, so I was kind of in my feelings about it. I know what I did wrong. It's them damn select all and apply questions that I got wrong. I always struggle with them. I always end up missing one of them. And she don't give partial credit. You either get it or you don't. And it was like maybe four or 5 select all and apply questions, and those are the ones that brought my grade down. So it wasn't that I didn't know the material. It was just those type of questions that had got me. So I'm cool with that. I'm cool with the 82, although I wish I would have done better. So this week I don't have much planned. I just have work. Got a few assignments that I need to do that I'm gonna just go ahead and get out the way today, since I'm off of work, and just chill. Try to gear back up for another successful week. We are in week 7 of the semester, so we only got 3 more weeks to go, and we are back on break again. So I'm so thankful that I've made it this far. I'm out here sitting on the rooftop. It's such a beautiful view, y'all, if y'all can see. I haven't come out here before, so I just made me some tea this morning and came outside and reflect with God, and just allowed God to just bring me back down, ground me, because when I tell you I was going through it. So I'm praying that y'all have a blessed, productive week. I pray that God keeps y'all sane, because y'all know we need it. And I thank y'all for coming back and watching and supporting your girl, praying for your girl. wishing your girl well, because it means so much to me. I can't thank y'all enough. Y'all don't know me from a can of paint. I said that before. And to have people who don't know me still wishing me well and praying for me and encouraging me, that means a lot. It means so much. So thank you guys, and I will talk to y'all next week.